Welcome, everyone. My name is Andrew Cardoso, and I'm president of the Pearson Center. As many of you will know, the Pearson Center is a progressive think tank that addresses the big economic and social issues of the day. In that context, I am pleased to welcome you to the 8th webinar on major policy issues relating to COVID. The earlier ones have covered issues such as the economy, long-term care, manufacturing and tourism sectors, and racism. Today, we will talk about COVID on the world stage, and it is the second seminar that we're having on this topic. What does this pandemic look like in other countries? What can we learn from other countries? And what should Canada be doing on the international and multilateral scene? I wanted to take a moment to thank our two sustaining sponsors, without whom this kind of event would not be possible. They are the Canada's Building Trades Unions and the International Association of Firefighters. Now back to the panel. We have some very experienced heads of mission joining us today, senior diplomats who have had a lot of experience in Canada and other countries, as well as multilateral organizations. Commissioner Sibongiseni Dlamini-Mntambo is the South African High Commissioner to Canada. Ambassador Juan Gómez Camacho is the Ambassador of Mexico to Canada. Ambassador Souriya Otmani is the Ambassador of Morocco to Canada. And Ms. Dana-Leigh Anderson is the Chargée d'Affaires at the Jamaican High Commission in Canada. I want to note a particular welcome to High Commissioner Dlamini-Mntambo and Ambassador Otmani as you return to the Pearson podium. Great to welcome you back today. Our moderator for today is Professor Jonathan Calof, who's a member of the Pearson Center Advisory Board. He's a professor of international business and strategy at the Telfer School of Management at the University of Ottawa. He's a competitive intelligence fellow and an honorary professor at universities in South Africa, Russia, China, and New Brunswick. So with regard to the format, the panel will last for about 40 minutes, the panel discussion will last for about 40 minutes, and then we will have time for Q&A with you, the audience. So please use the question box on the side to send in your questions during the session. We'll do our best to end promptly at 3 p.m. The session is being recorded and will be posted on the Pearson YouTube channel later this afternoon, where you will be able to review it as well as our earlier webinars. Just go to YouTube and type in the Pearson Center and you'll see all our past and today's webinar. So with that, over to you, Jonathan Calof.
Thank you, Andrew, and thank you as well for putting together such an incredible panel for us to listen to today. Not only do they represent a diversity of perspectives in dealing with COVID, they all have extraordinary experience at the international level as well, that I'm looking forward to hearing from as we look at how to deal with a very complex issue as well. Each of your countries has a very special relationship to what I'm doing in the past, what I'm doing now, and I enjoy talking to all of you leading up to it. I just thought because it's an international flavor and our audience might not be as familiar with what's happening in COVID in your countries, I'd like to go through and ask you a very straightforward question about bringing us up to speed in terms of the current situation of COVID in your country and how you're estimating it's likely to unfold in the months ahead. And I'd like to start off with High Commissioner Dlamini-Mntambo, who gave congratulations on getting into level back to school.
Thank you so much. Let me say, as of today, there have been more than 240,000 confirmed cases in Africa and just over 7,894 deaths. But the three countries with the highest number of cases are South Africa. We are now approaching about 98,000 cases, followed by Egypt at 55,233 and Nigeria at about 20,400. South Africa is the worst hit in sub-Saharan Africa and has nearly a quarter of all the cases on the continent, with close to 1,900 deaths and about 52,000 recoveries, which is more than 52%. The country currently ranks second to Egypt for fatalities. Patient zero, if you would remember, originated from Italy, which was previously the epicenter of the virus. So nearly 2/3 of the country's cases are currently in the Western Cape province, which is a major tourist destination. And as of the 20th of July this year, the level of confirmed infections in South Africa is around 886 people per million of the population. Remember, we are about 55 million in South Africa. And by contrast, countries like the United States and the United Kingdom have between 4,198 and 6,010 coronavirus cases per million. Now, South Africa continues to fight to flatten the curve despite the upsurge of COVID-19 cases. And at the end of March 2020, President Ramaphosa declared a national state of disaster, including a nationwide lockdown to contain the spread of the virus, to slow down the transmission rate, and to conduct vigorous testing. So far, the country has been successful in delaying the surge of infections. South Africa has also managed to delay the spread of the virus by also embarking on what is called doubling time. That is the number of days it takes for the total number of cases to double. Before the lockdown, the cases were doubling like every 2 days. That was during level 5. So we have lifted some restrictions, and now the number is the doubling is about 12 days. By delaying the spread of the disease, South Africa has been able to strengthen the capacity of the health system and to put in place wide-ranging public health programs. The country has increased the number of intensive care units and beds in field hospitals. In addition to strengthening our public health response, government has also introduced several vital measures to support the companies, to support the workers, and to support the households that have been severely affected by the lockdown. This includes an economic and social relief package worth over 500 billion rands to help companies in distress and to save jobs and to provide some income to informal workers and poor households. So that is the current situation in South Africa right now.
I can tell that your past background included being a teacher. That was extraordinarily informative and very accurate on that one. Thank you very much. I'm going to go over to Jamaica, Dana-Leigh Anderson. Congratulations, by the way, June 15th, your tourism sector started opening up. So give us a bit of a sense as to the current state and how things are going forward.
Okay, thank you so much. So currently in Jamaica, with a population of about 3 million persons, we have currently 659 cases. That was as of Sunday, June 21st. What has been happening is that we only have had 10 deaths, which is in terms of percentage, that has been good, and our recovery rate has been at about 70%. The government has also increased testing, which, with the help of donations in terms of providing testing kits, we've been able to fast track testing, which is the key to finding persons who have been infected. So as you mentioned, the borders were recently, well, not fully open, it's in a transition phase. So what's happening is that as of June 15, international visitors have been able to enter the country. And by entering the country, they have to do a pre-authorization travel testing. So what that means is that they need to go to the visitjamaica.com portal, and they will have to answer some questions there, and they will get an authorization which they have to present on boarding the flight. And that also applies to our nationals who have been repatriated over a period of time, and up to now as well, and they too have to register on a portal, and this helps with contact tracing. So should there be anyone with the virus, then they'll be able to have their information right there, and they'll be able to track the person to find out where the person is. So on arrival in Jamaica, what is done is that if you're outside of the travel bubble, which is mainly consistent of countries in the Caribbean who have a lower risk of have shown more fewer cases of the coronavirus, they do not have to go through the testing as much unless suspected otherwise. But for persons coming from more high-risk countries, which currently includes the countries that support us most in terms of tourism, which is the US, the UK, Canada, of course, and Europe, persons have to be tested on arrival. They'll be screened and tested. If they are okay, then they will be asked to go to their intended place of accommodation. And currently for tourism, we are only having what they define as a resilient corridor. So persons can only go to the northern coast, and they are limited to that area. So you cannot traverse between different parishes in the island. So that is a way of keeping track and to ensuring the safety of the general public and also for the tourist safety. And as of now, masks are mandatory. So that's a part of the progress of the country in terms of helping to limit the spread of the disease. In terms of repatriation, Canada was also helpful in helping us repatriate at least just about over 100 persons. Before the up until June 10th, we had the highest number, about 86 persons who returned home, thankfully, to the Canadian government, who were very helpful in helping us coordinate this. And we have been rigorously testing, and I think that's the key, as my colleagues here probably can attest to that. The key is testing to find out what's happening, and home quarantine is also in place, where persons, once you arrive on the island, you are expected to do 14 days, not necessarily for tourists, but for persons who will be more nationals, will be integrating with the population a lot more. So this is a precautionary measure so that persons will be aware within a certain time if they do have the test. So sure, there's a bit more I could cover, but just to give my other colleagues a chance to share what's happening.
Just one quick question on that one. When you say that they're tested upon landing, what sort of a test are they being subjected to on landing?
Right. So on landing, there is this, as I say, persons from high-risk countries are tested. So it involves the nasal testing. So okay, that's done, and if the test results come back within 24 to 48 hours, and if the case is positive, the person is positive, they will be isolated from their intended accommodation, and they will be put in a public facility. If it is that they're at a hotel, then they'll be asked, hotels have to have a place where persons can isolate. So that's already in place, and that's Ministry of Tourism has emphasized that this is a part of what's needed for them to be open. So if a tourist gets sick, they will have to be isolated at a hotel and quarantined until their possible repatriation. So yeah, it's nasal testing on arrival, for sure.
No, I hope, and again, this is back to credit to you, Andrew and Pearson. What we have on the panel are countries that are different stages of development on COVID. So the ability to share these experiences across the board is going to help us in terms of developing policy, not just understanding what's happening internationally. And to that, I'm now heading over to Morocco, and Your Excellency Otmani, if I understand correctly, on Saturday, they announced that they're going to start easing restrictions in Morocco. And you have been in lockdown on March 20th. You were one of the early countries to do it. So congratulations on starting phase 1 of the release. What can you tell us about the current situation and how it's evolving? Hold on a second. I think you're still on silent.
Can you hear me now? Yes?
Yes. Yeah.
Yes, okay. So Good afternoon, everybody. Greetings to my fellows panelists, and thanks to the Pearson Center for inviting us to be part of this webinar. I'm sure it will be a very interesting one, since we are going to hear about our respective experience regarding the best practices regarding the management of this pandemic, COVID-19 pandemic that we are facing. It is a virtual meeting, but I hope that we will soon resume our normal meetings that the Pearson Center used to organize for us. It will be better, I mean, to have a human-to-human contact and communication. I'm sure everybody agrees on that. So as regard the current situation in my country, Morocco, likewise, all other countries of the world has been hit by the virus. The total number of cases as of today stood at around 10,172. It's the figures that I got this morning. We have only 15 people in intensive care, and the number of fatalities are 214. Morocco has today one of the lowest fatality rates in the world. It's less than 2.1%. 82.2% of our COVID-19 cases have already recovered. My country, of course, continues to enforce strict monitoring, and we are having like 20,000 tests every day. It has been said and hailed that Morocco managed successfully the pandemic, and I think it's true, and it is because we had a brave, quick, effective, and coordinated government response to it at the early stages of the outbreak. And thanks to the clear and smart vision of our head of state, His Majesty the King, Morocco adopted a series of measures based on a preventive and proactive approach to slow down the spread of the virus. We all know that this pandemic came all of a sudden. It took everybody and every country by surprise. We were not prepared. We got no specific sanitary protocol. We had no masks, no medicine, and therefore for us, I mean, protecting our citizens' health and saving lives were the highest priorities. And you know, when you have to do that, you have also to make sacrifices. So of course, we decreed the sanitary emergency situation, and we imposed the strict lockdown, as many other countries did all around the world. And then we managed also in a very short period of time to equip new hospital units and increase the number of intensive care beds. So despite the shutdown of the economic sectors, we managed to have food supplies in a steady and sufficient quantity. I also take a tremendous pride with the fact that a central component of Morocco's COVID-19 response has been also the broad-based industrial mobilization. You know, many countries are still dealing with shortage in medical and protective equipment. Morocco started local production of sanitary masks, gowns, and medical devices, which enabled the country to get certain autonomy in that field. Nowadays, the Moroccan factories reached a daily production of 10 million masks. The country even exports its production surplus, and we are exporting also some protective covers and many other medical equipment. I have to tell you that in the very beginning, we were not at the level of my embassy. My colleagues and I were not able to find masks, sanitary masks. We're not able to find alcoholic gel. So I had to get it from my country. So I have also to tell you that young Moroccan, especially engineers, students, scientists, doctors. They shown resilience, intelligence, innovation, and patriotism to fight the COVID-19. They developed a ventilator model with oxygen mask, 100% made in Morocco. They developed also COVID-19 diagnostic kits. So another important, I think, initiative that we enjoyed is that the launch of the Special Solidarity Fund, which has so far collected on a voluntary basis more than 3 billion euro in donations from company, institution, and ordinary Moroccan people. This fund helped a lot in absorbing the negative repercussions of the lack of the economic activity and provided allowances to informal sectors workers. And you know that this informal sector is very important in my country, but also in many other developing countries. So it helped a lot. This is, I mean, the way how Morocco, I mean, I think successfully dealt with the COVID-19 up to now. And as you said, Dr. Jonathan, we are now opening little by little. We have 2 zones. There is one green zone in the country, 60% of the total of the population. So they are free to move and they resume all their normal activities. We have another zone which still has many cases of COVID-19. So little by little, we are resuming our normal activity. People now will be able to go to the beaches. Restaurant will open after tomorrow. Coffees, public baths. You know how much it's important for our society to go to the hammam. So we are happy that and we expect also the opening of the international border very soon, hopefully.
Well, I look forward to seeing how that goes, especially since every time I'm in Morocco, the concept of personal distance doesn't exist. We like to hug, we like to kiss, as in Mexico as well. And Your Excellency, you know, we'll talk. I'm going to ask you next, but you know, I got to tell you, I was very impressed at how quickly you were able to increase the intensive care beds by over 400%. It's some very impressive developments that I've seen in Mexico.
Yeah.
Give us a state of where you're at and where things are going.
Thank you so much. First, you are totally right. The toughest thing is going to be not to kiss. Because yes, you read us correctly. We kiss, we hug, and everything that is touchy. Well, first, we have now around 185,000 infections and around 25,000 deaths. Of course, in a population of 130 million people, so per million is challenging, but we are more or less average to put it somehow. It's very complex. It's very complex because the pandemics is not only about preventing infections and certainly deaths, but also trying to mitigate as much as possible the economic impact that is going to happen or is happening together with the pandemic, creating enormous damage to the future. And that's where Mexico has been focusing, as other countries in the world, to make sure that we find the right balance, the right formula to achieve both, mitigating both things at the same time. You are totally right. We have had quick capacity to develop infrastructure, health infrastructure. In a way, it was a race against the virus. But I think there we've been very successful because despite the numbers that we have, these 195,000 people, no hospital has yet struggled with occupation. They have been 80%, 90%, but capacity remains available. And this is very much because of what you just have said. Second, we have, or third, we have taken a somehow less orthodox avenue in terms of testing. The government, instead of testing massively, has been testing more surgically, if you like. So mostly we've been testing people with actual symptoms or people connected to those that have had symptoms, let alone the infection, instead of going broad to test everybody in a country, of course, of the size and the population of a country like Mexico. I think it has worked. There is, of course, as it happens everywhere, is another challenge that many infections and potentially deaths are not caught by the radar, and this is totally normal everywhere because many people simply don't have any symptoms, or if they go through the pandemic or the disease, 90% of them recovered, and you really never know. So down the road, the next challenge is to make sure that we put in place the antibodies test, so we really know what the status of the population. But that's where how we've been approaching to this. Now, back to the point of balancing the need to reopen the economy, we have put in place a sort of light system in the country, like a traffic light with 4 colors: red, orange, yellow, and green. And each of the 32 states in the country are allocated the color they are in. This is a combined decision by the federal authorities and the state authorities that have enormous autonomy and enormous responsibility, of course, in taking the measures to prevent the virus. So now there are, if I'm not mistaken, 17 countries or states already in orange, the second level after red, and the rest of the country is precisely still in red. One important thing to say is that when we locked down the country, we never took any coercive measure to force people to stay in. And we never closed the borders of the country. We kept receiving travelers, flights, everything remained open. Whoever wanted to fly into Mexico, they could do it. We just took the necessary basic measures to make sure that they are okay. And this is a lesson we learned the hard way when we had the pandemics in 2009. That, as you know, started in Mexico, and the isolation Mexico experienced, it was very harmful economically, and it did nothing to stop the pandemics or the dynamics of the infections. And again, as a lesson learned, despite other countries have done it and we respect it, we did not. Now the economy is slowly coming back with this combination of colors. We have, for example, we have expanded the designated or the sectors designated as essential. That means that even if the country or the state is in red, they can operate. In 17 states that are in orange, all the rest of the industries can start opening up and go back to work, provided that they remain at 30%, if I'm not mistaken, in their operations, the number of workers there, etc., etc. The tourism sector is starting to come back slowly. The Riviera Maya, for example, is open again, but the rules that hotels can only work at the same 30% of their occupation, restaurants, tourism activities, the same except beaches. beaches remain closed. As I said, the real challenge is that we will all have to learn to coexist with the virus. There will be no vaccine in the next few months, and once the vaccine is there, it will take a lot of time to be distributed and start the process of immunization. So we can't remain locked down until then. So the question is to what extent we manage to put in place measures that really mitigate the risk, that allow the economy to work, and also we all as society and communities will have to change our culture to do things, or the way we do things, because otherwise it will be absolutely impossible. You can see now everywhere, and Mexico is not the exception, that there is already the impulse of people to go out. You can't keep people locked down forever, even if their economic conditions are okay, let alone when they are not okay. So I think and that's where we are in Mexico, we need to start rethinking how we do it. So that's where we are. We are at the peak now of the pandemics, as most of Latin America, because the virus came at least a month later, using the US as a base. But I think in terms of the pandemics, tough, it is very tough, it's very serious, it's very risky, but we are navigating okay. The challenges that we can see in the future are enormous, precisely because the economy. You see the Latin American economy average, we lose 9% of GDP, and many forecast double digits negative growth. So this is what is occupying us really very seriously.
Thank you for sharing that. And again, very good comments about what you're doing going forward and the difference in your program. And it's interesting that, you know, when Your Excellency, when you talked about the Morocco experience, and you're right, there's no playbook on this one. You were talking, you know, Your Excellency Gómez, Camacho, about having to draw upon prior experiences. We have no playbook going forward. We don't have the playbook on changing culture. This is an ongoing learning, and I credit all four of you during your lessons about what's worked and what hasn't worked. So let's go to the role of the multinational organizations. Let's go to that international community. Given that there is a lack of practice information, scientific information, you know, what should we be doing at the multinational agency level in terms of moving forward, in terms of when the next virus starts going around? And I'm going to like that because apart from everything else, you did serve on several international organizations, including Mexico's representative in the United Nations, in the EU. What do you see in terms of the multinational role of these organizations in something like COVID and in helping move countries forward? What should they be doing?
Yeah, thank you. I think we are not doing what we should be doing, and I will tell you why. Well, first, what I think we should be doing. What we should be doing is to have a very strong multilateral system on health, mostly WHO, that is there and is good, is effective, that can help us to react collectively in a coherent manner, instead of in a panic/chaotic way. And this is another lesson of 2009. In 2009, all the challenges and the negatives of trying to contain the pandemics was precisely that we all were reacting in a, let me put it this way, normal, self-interested, but misguided self-interested way. And I wouldn't say this is exactly what it is happening now, but pretty much so. And this time, unlike others, the multilateral system hasn't been able to provide this collective coherence, because we are living now or going through a highly polarized international environment. The race for the vaccine is, in my view, this is me thinking this, is not only a massive effort to develop a vaccine, which it is, but it has also become in many ways very geopolitical. Who produces a vaccine, where, who has it first, is a very big challenge. Another big challenge is that once the vaccine is out there, we don't have a clear scheme to how distribute the vaccine. And I think something still missing is that the work between the international system and the pharmaceutical companies led and helped by member states is still not strong enough or not clear enough. We need a pharmaceutical industry. We need a thriving pharmaceutical industry. We need them to successfully produce these vaccines. We need to help them, and they need to really partner with countries and with the system. That seems to be happening, but not really, not clear enough. But again, we will see how it goes. But in my view, clearly we are falling short. There is a very anarchic process outside. You see many forces operating, trying to get the vaccine, thinking one thing or the other regarding the global system, some in favor, some against, coalitions in Europe, coalitions with Asia, countries participate. Again, many efforts, but in my view, too anarchic,
Right.
or to be efficient.
Let's go over at Jamaica to Chargée d'Affaires Dana-Leigh Anderson. You just came off, as I said, 2 weeks ago. Your Prime Minister and Canadian Prime Minister hosted a session on COVID-19 response, less developed countries. What are you seeing in terms of the role of the multinational organizations in terms of helping moving forward and dealing with this crisis? What came out of that?
Well, I think just like Ambassador just said, you know, COVID-19, it's, despite its challenges, is really a test of how much we say what we are, that we are. You know, as a community, you know, on the internet, multilaterally, right now, everybody's looking out for mostly their own interests. And this is a time to realize that even with all the challenges that's going on with COVID-19, this is not a time to pull apart. It's a time for us to come together, because that's the only, I mean, we just have, right now we think it's about us, but somewhere down the line, we are still going to have to depend on each other. And the self-interest is not going to pan out in the long run. In terms of multilaterally, with the UN, the Sustainable Development Goals are, you know, are still in focus, and even our Minister of Foreign Affairs and Minister of Foreign Affairs here in Canada met recently on matters concerning that and other multilateral institutions, just as the IMF, because regrettably, well, the good thing is our country was able to conclude the IMF in months past, and then because of COVID-19, we had to jump back in asking for a loan where that is concerned. But the IMF has agreed to assist us in with the disbursement of about $520 million. But I think collectively, multilateral agencies will be basically just tested to as much more than ever where that is concerned, because at the end of the day, a lot of countries rather to do it multilaterally than a bilateral level, because for example with Canada, we are benefiting through PAHO. For example, Canada has donated to the Caribbean and other countries through PAHO, and we're very grateful where that is concerned. And in other areas, multilateral agencies has now stepped up in filling the gap where bilateral you know, cooperation is not possible right at this time. But I've seen where, you know, in cases of the IMF, the UN, G20, this has become clear that persons and countries are still willing to step up despite the natural need for self-preservation. I believe that just the sense of cooperation and understanding that together we can pull through this crisis, that's what's going to keep us going as countries, as a global pandemic is still in our reach, and we still have to find solutions where that is concerned, and that takes a community a global community.
And that's back to the whole cultural aspect of COVID.
Right.
I'm hearing a consistent message all the way through. Ambassador Otmani, I mean, Morocco is taking an active role in Africa, particularly in French Africa. What do you see in terms of multilateral, you know, as a follow-up to what you were hearing from the others on the panel? Oh, we're still waiting for your voice to come on. It's coming. I think you're on now.
Okay, so sorry, I have some technical problem. Sorry. Yes, as you said, I mean, regarding the role of the international aid or multilateral institution, I want to mention that, as you just said, Morocco just last week carried out a vast solidarity operation with some 15 brotherly African countries, delivering masks, protective equipment, and medicines to allow those countries to treat COVID-19. So it is mainly by really by solidarity. And I think that even, I mean, within African countries, between us, we have a lot to share. There are many things that we can, I mean, good practices that we can exchange. We can, I mean, we have to trust ourselves and to try to take the best of each country and to exchange on it. I would like also here to commend at the initiative instituted by Canada and its foreign minister, François-Philippe Champagne, who succeeded in during the pandemic in setting up an informal group of foreign ministers from several countries, I think 15. The purpose of this of setting up this group is to exchange, because the group is still working, is to exchange vital information between the heads of diplomacy of several countries at a time of health crisis on the scale of the one we are experiencing. So I'm delighted that my country has been invited. My foreign minister joined the group, and he participated in the exchanges. And the group used to meet on a weekly basis. So within this framework, they talked about, they discussed, they considered the supply chain problems, the food supply, the repatriation of nationals stranded abroad, and other important issues of bilateral and multilateral interest to the country concerned. So in my view, this is a perfect illustration of the role and the necessity of multilateralism. And it allows for direct contact and communication and the consideration and solving of several delicate situations. Multilateral institutions, in my view, are really indispensable and irreplaceable for sharing the information, whether it is information, scientific information, medical or international aid. Our world today, you know that very well, is interdependent, global, and countries are interconnected. So we have seen how the epidemic originating in one country could turn into a global pandemic only after 3 or 4 months. So the world's health, climate, security, food, and other challenges are global. So they require a global and multilateral treatment and response. When it comes to scientific or medical information that puts the lives of millions or billions of people living on Earth at stake, I think this is the case with everything related to the COVID-19 pandemic. So there is no need to discuss that. We must move beyond the selfish interests of nations and start working together for the safeguard and sustainability of the humanity. Thank you.
Thank you very much. High Commissioner Dlamini-Mntambo, what about yourself? You are the former chair dean of the of the ambassadorial community in Ottawa. You're more multinational, more multilateral, I think, than anybody. What is your take on the role of the multilateral in terms of dealing, whether it's scientific information, sharing, aid? What do you see?
Thank you so much. You know, now more than ever, the world needs international and intersectoral collaboration to fight this pandemic. Last week or about 2 weeks back, I was invited at an event organized by Global Affairs Canada, and I did touch on this very same issue on the need for collaboration, given the significant ramification of COVID-19 globally. I pointed out that unfortunately, this virus, it respects no borders, it respects no status, and it does not recognize developed or developing, nor does it understand powerful or weak countries. I caution that how we respond as the world today, how we respond to the pandemic today, will define our tomorrow, because with this virus, unfortunately, the richest or most powerful country in the world is as weak as the poorest. And this simple fact underscores the urgent need for the rich countries to support developing countries' ability to combat the disease, especially countries which do not have responsive health system. You know, the severe and wide-ranging consequences of this pandemic will be experienced by all countries around the world for some time to come. I think this is what has been highlighted by my fellow panelists right now. Africa has been very vigilant, I must say, in controlling and monitoring the travelers from virus hotspots. And perhaps this is why the number of cases in Africa is lower than elsewhere in the world. A rethinking in how the international community interacts with and responds to such a crisis make it necessary for collaborations to mitigate the impact of this pandemic. The international community has to work in the spirit of human solidarity and cooperation. In Africa, we call it Ubuntu. We have to work in cooperation with one another to strengthen health systems globally, including through supporting the World Health Organization. There have been calls in some places with a threat to withdraw funding to the World Health Organization, but this really my country does not support. The World Health Organization is a lead United Nations specialized agency. It has been mandated to promote health, to ensure universal health, and to make sure that there is coordination. It has in place a research and development mechanism that aims to improve coordination, to accelerate research and development between scientists and global health professionals, and also to develop new norms and standards to learn from and improve upon the global response. The WHO, that is the World Health Organization, also launched a solidarity call to action, which calls on all stakeholders and the global community to commit to undertaking actions which are urgently needed to advance the sharing of knowledge, intellectual property, and data that will benefit all humanity. You know, as the chair of the AU, South Africa has also approached its leadership challenge on this issue within the abiding context of Pan-Africanism, solidarity, and coordination. Our emphasis has been on a comprehensive and coordinated continental approach. Now, considering the magnitude of the task at hand, the AU Bureau has established an African COVID-19 Response Fund as a key intervention to mobilize and direct resources towards the continent's response to the challenge. Thus far, the fund has also provided an amount of $4.5 million as country donations to augment the coffers of the CDC Africa to enable it to discharge its responsibility more effectively. The African Union has also approached the G20 countries with the request to advance a comprehensive stimulus package for Africa, which would include, amongst others, deferred payments and the suspension of interest payments on Africa's external public and private debt. The aim behind this initiative is to enable Africa to build adequate fiscal capacity to respond to the COVID-19 and other needs. The AU considered it morally untenable to maintain, for instance, economic and other forms of sanctions against countries like Zimbabwe and Sudan during these trying times. To this end, the AU has called for the lifting of economic sanctions against these two African countries. In South Africa, we are also collaborating with various institutions outside South Africa to find solutions. This morning, for instance, the university, the Wits University in South Africa, based in Johannesburg, announced that with its collaboration with the University of Oxford and the Oxford Jenner Institute, they announced that soon they will be ready to start on the first clinical trials for the vaccine that will prevent infections by SARS-CoV-2, the virus that causes COVID-19. So this is one area where the collaboration between the two countries, it seems to be making some headway. And I must also indicate that about 2 weeks back, also the Oxford University in the United Kingdom, it announced a breakthrough in the treatment of patients on ventilators using the drug dexamethasone. The findings that the drug reduces mortality by about 1/3 have been most welcome in South Africa, as this drug is also manufactured in my country. What is good is that since it's manufactured in South Africa, Africa will have access to this drug. And I don't think they will be paying exorbitant prices to get the drug compared to when it was manufactured outside Africa. So I believe that collaboration is very, very important. This pandemic, unfortunately, it cannot be about one country looking within itself, but we have to look at how best we can work towards addressing the challenges that are facing the whole world.
It shouldn't surprise anybody on this panel that with the responses that you've been giving about the need for multilateral, the need for a global approach, and Your Excellency from South Africa, the African-wide approach that South Africa has been involved with, that we've had a whole bunch of questions, and I want to get it right from the audience. They said, in light of Canada not winning a seat on the Security Council, should we be doing our multilateral work differently, especially with regard to COVID-19? And I'll start off in Morocco on that one with Ambassador Otmani, because you had mentioned something about Canada's efforts with our minister. Ashley, yes, that was done quickly. Thank you.
Yes, okay. So, yes, I was talking about the, informal ministerial, the formal, informal ministerial meeting that is taking place on a weekly basis, and that was instituted by Canada. And that was dealing, of course, with a lot of important matter, especially
right,
regarding this exceptional situation that we are living all around the world. So I said that Canada was, within this group, trying to solve with all the other foreign ministers, including mine, a lot of crucial questions regarding the treatment of the pandemic. And I think that Canada helped a lot in that sense. And we also helped Canada solving a lot of matters, that it is also important. But what was important is that we did it in a very short period of time. Usually you need to write, to send letters, to make communication, and it could take time. But when you do it very quickly, you do it through a virtual conference like the one we are having now, you can solve easily problem. So I think that Canada, of course, could play is playing an important role and could play could really, consolidate its role on the regional level, on the international level, that's for sure. We need to cooperate and we need to exchange experiences with Canada. We will, of course, encourage Canada to be more active on the African continent. And I think that we are doing now a lot of good job at this level. Since really Canada, I think we felt it. Canada is back on the African scene, and hopefully it will stay there and for good.
Oh, I like that answer. Ambassador Gómez Camacho, as a very valuable member of our North American gang here, same question to you. Does Canada need to change the approach in light of what happened? What should they be doing on the COVID-19 in that respect, on multilateral?
No, I don't think Canada should change. And I think Canadians, if I may say this, should not overinterpret the final result of the election to the Security Council. It's a tough race. Canada did great. Someone wins, someone loses. It's tight. It was very tight. So it's very sad. I think the Security Council will miss Canada's contribution, but I wouldn't speculate even more. It's not a question of soul searching, as sometimes I read in the news press here, in Canada. Second, I think also it's important to demystify a little bit the Security Council. The Security Council has, on the one hand, a very specific mandate, peace and security, and it spends a lot of time fundamentally blocked. So it doesn't have a real role on the pandemics itself. It has a very specific areas to work, but nothing to do with pandemics, health, and the current challenge. No, I think Canada has to keep doing exactly what it does, which is keep engaging the international community. One very good example of what Canada can do, and I'm saying this not because I'm ambassador here, but because I've seen Canada for years in the international organizations, and I was in the UN just before coming here. My very dear friend, your ambassador there, Marc-André Blanchard, had this idea with Jamaica that it was already explained, which is more important than is being seen or read. The biggest challenge after the pandemic, or even with the pandemic, as I was saying before, is going to be economic. And for developing countries, this is a true conundrum. How you manage to keep your population safe and how you manage to keep the levels of well-being is very difficult. And this is going to require enormous amounts of financing, smart, clever financing, fundamentally of the SDGs. This idea, Canadian Jamaica idea, that has been in the oven for 3 years at least, it can be very important. The fact that Canada took this issue, for example, to the G7, financing for this, the fact that Canada took it to the G20, I know it has done it. This is exactly what Canada has to keep doing, let alone other efforts that Canada is doing. But conclusion, I would demystify the Security Council. I wouldn't overinterpret the result of the election, and I wouldn't change too much of what Canada does in terms of development, cooperation, strengthening of the international organizations, and so on and so forth.
Given that you brought in Jamaica in your answer, Dana-Leigh Anderson, I got to bring you in on this one too. So what do you say in terms of what needs to change in terms of Canada's approach to multilateral?
Well, I think I think Canada is doing what Canada does best. And to be honest, I think Canada has been engaging or trying to engage more, even in our area, the Caribbean, in terms of the CARICOM. We've seen efforts to continuously engage, and we have a strong bilateral relationship with Canada, and that keeps growing. We do have been looking forward to seeing Canada, Prime Minister Trudeau visit us at some point. But at the end of the day, there's always conversation going. We have good programs with Canada, even the seasonal workers program that has continued even despite of COVID-19. So I think engagement with our side of the world, it should just be continued, and it should be maybe on a more stronger level. I mean, you can always encourage that even more, but I think that, as the ambassador said, it should probably not read too much into it. I know it's seemingly an embarrassing moment, but I think the work continues, and despite all that, I think as long as we understand the importance of reaching out to different regions and to realize that Canada is still a strong presence and the relationship is still strong and going, then that's what needs to continue to be done. So I mean, we did feel it because we do support Canada, and we wanted Canada to be represented. But I would say keep doing what you're doing. I don't think you should over think what's going on, but just continue pressing and just be true Canadians in how you engage the world. Yeah.
Last comment to our High Commissioner on Canada's approach. Oh, we don't have your volume. You're going to have to unmute.
Thank you. That's a difficult one, but I think I tend to agree with Excellency Gómez. Let's separate the two issues, because COVID-19 is only now, and the security and the lobbying started long time back. So it cannot be that we put this together. But in all fairness to Canada, I think perhaps their attention was more, the country's attention was more drawn towards the negotiation of NAFTA, while the other countries were busy working like crazy, lobbying. So by the time Canada was ready, it had to try and cover a lot of groundwork, and the other countries were very advanced. That is my thinking. But it's not to say we did not support Canada. We supported Canada. We really wanted Canada to get a seat. But also, Canada must also, I think, has one advantage with Africa. Africa trusts Canada. Africa would like to work more with Canada. And we would like to see more of Canada in Africa, because this is one country, when you compare, I'm not going to mention countries, we think, okay, Canada, for us, in particular, South Africa, we really trust Canada, and we know that Canada has done a lot for South Africa. But also the same applies to the other African countries. There is no baggage with Canada. So you have a very clean slate from which to start. Canada must just make itself visible to the other African countries.
All right. I mean, we're now a little bit past the top of the hour. I'm going to pass it very shortly off to my friend Andrew Cardozo for closing words. But I've got to say to all of you, to all four of you, thank you very much for your candor, for your insight, for your comments. It's so rare that when we have an event like this that people are willing to share the good and the bad, to be critical at a diplomatic level of actions taken by others, complimentary of what they've learned from others as well. This was a very balanced discussion that I hope we can continue more of in the future. And I'm with you, Ambassador Otmani, face to face over some nice coffee. whatever it might be. I've got to tell you, I'm looking very forward to being together longer in a room to discuss this even in more depth. But very big thank you for what you've shared with us. Andrew, back to you. You got to turn your volume.
Can you hear me now? Okay. Thank you, Jonathan. Thank you, High Commissioner Dlamini-Mntambo, Ambassador Gómez Camacho, Ambassador Otmani, and Ms. Dana-Leigh Anderson. Thank you very much for sharing your enormous insights with us. Thank you to Jonathan Calof. Your experience and knowledge of so many countries really came through and was very useful to our discussion today. I think this discussion is profound for us on two fronts. One is in dealing with this terrible pandemic of COVID-19, but the other is your comments towards the end about where we go. I mean, there's certainly going to be some soul searching in Canada about our foreign policy. Thank you for your ideas about whether we should stay the course or do some tweaking and rethinking. The Pearson Centre will be examining this issue and putting some ideas forward about Canadian foreign policy. And I think, in a sense, the two issues of COVID and the Security Council issue give us pause to think through our place in the world. There's a long history of our being involved in the world. Our centre is named after Lester B. Pearson, one of the greatest multilateralists in Canada and indeed internationally. So we certainly look forward to this discussion. And I do want to ask all of you to keep involved with us on that discussion, because your guidance is awfully important. It's not good enough for us as Canadians to think about and chat among ourselves. We really want to keep hearing from you the kind of role that we should be playing out there. So thank you for your time today. And since the others can't hear the applause, I'm going to ask you to clap for each other as we close out the session. So well done, everybody.
Thank you so much. Thank you.
Thank you.